Hello everyone, welcome to Shanxi University of TCM. Today we will go on our study of treatment of insomnia by acupuncture and moxibustion. We will learn from the following 4 aspects. First, we should know what's the insomnia. Insomnia refers to inability to have normal sleep, marked by difficulty to sleep, eagerness to wake up, inability to sleep after waking up, or shallow sleep, even keeping awake or dreaming all night. Insomnia often occurs together with headache, dizziness, palpitation, and amnesia. It is usually caused by anxiety, overstrain, emotional upsets, weakness, and prolonged duration of illness, as well as improper diet that lead to dysfunction of the heart, liver, spleen, and kidney, as well as insufficiency of qi and blood. Totally, insomnia pathogenesis in TCM is yin and yang disorder. Okay, let's understand how to diagnose this disease. According to syndrome differentiation in TCM, if the patient's syndrome is dreamless, especially nightmare, and illness to wake up, dysphoria, and susceptibility to range, maybe the patient tells you he's easy to get angry, dizziness, distension, or pain in the head, distending pain in the chest, bitter taste in the mouth, thirst, yellow urine, and dry faces, red tongue with yellow fur, tall and rapid pulse. In TCM, the tall pulse is like a string. If the patient who has the above symptoms will be diagnosed hyperactivity of fear in the heart and liver in TCM. The second type is flame heat disturbing heart. For this type, the symptoms are insomnia and dysphoria, dizziness, and heaviness of the head, fullness, oppression, pain in the chest, and epigastrium, vomiting of thick phlegm, bitter taste, and sticky sensation in the mouth, red tongue with yellow and greasy fur, slippery and rapid pulse. Generally, phlegm symptom is sticky sensation in the mouth, a little nausea in the morning, vomiting of the thick phlegm, slippery pulse, and the heat symptom generally is bitter taste, quick temper, and often angry, red tongue, and rapid pulse. The third type is asthenia of both heart and spleen. For this type, the symptoms are difficulty to sleep, dreamlessness and illness to wake up, palpitation and amnesia, spiritual lassitude and fatigue, anorexia, pale complexion, light-colored tongue with thin fur, thin and weak pulse. The fourth type, disharmony between heart and kidney. Generally, the patient's symptoms are dysphoria and insomnia, dizziness and tinnitus, feverish sensation in the palms and soles and chest, dry mouth with scanty fluid, aching and weakness of lungs and knees, and palpitation amnesia, seminal emission, red tongue, thin and rapid pulse, emphysema lumbus in the halls of the kidney. Kidney deficiency may lead to aching and weakness of lungs and knees. Kidney organs dominate reproduction. Kidney deficiency can also lead to seminal emission. Okay, let's learn how to treat this disease by acupuncture and moxibustion. First, body acupuncture. Prescription 百会 GB20, 神门 87, and 三阴交 SP6, spleen 6. Those pictures show the pressing of the points. Modification. For exuberance of heart and liver failure, 风池 GB20, 劳宫 PC8, and 行间 LR2 are added. For phlegm failure disturbing the heart, 风池 GB20, 内关 PC6, 丰隆 ST40, and 立对 ST45 are added. Stomach ST40, this point always used to treat phlegm syndrome. ST45 always used to treat nightmare in clinical work. For asthenia of both heart and spleen, 心苏 BL15, 脾苏 BL20, and 足三里 ST36 are added. We should know the back points are located on the back and waist among the first lateral line of the bladder meridian and are the regions where the qi of the viscera is infused. Back always used to treat disorders of their related visceral disease. 心苏 and 脾苏 are connected with heart and spleen organs disorder. For disharmony between the heart and kidney, 心苏 BL15, 肾苏 BL23, and 太溪 KI4 are added. Performance. For exuberant liver failure and heart failure, phlegm heat attacking the heart, reducing techniques are used. For asthenia of both the heart and the spleen, reinforcing techniques should be used, and moxibustion should be applied to back sore. Acupuncture. For disharmony between the heart and the kidney, turning rotating techniques for reducing purpose are used to needling. 神门 HT7, reinforcing techniques are used for needling other acupuncture. Ear acupuncture always used to treat insomnia. Prescription. Ear 神门 TF4, ear heart CO15, ear kidney CO10, spleen CO13, and subcortex 84 are be selected. Performance. Each time 2 to 3 points are selected and needled with moderate stimulation, and retained for 20 minutes. 王部流行指 always used for ear acupuncture, pressing and pressed 2 to 3 minutes before sleep. Good results can be received with acupuncture treatments for this disorder. It is suggested that treatments be done in the afternoon or before going to bed. The results will be much better if the needles are retained for a longer period of time. Emotional changes will dramatically influence this disorder, so maintaining a pleasant disposition is very important. Proper exercises will be beneficial to recovery. For the exercises, we will suggest the patients relax and practice abdominal breathing before going to bed, or practice sitting with the waist relaxed and legs straight for 10 minutes. It's also helpful to sleep. Of course, other exercises are also okay. The last, pay attention to the patient's digestion system, because traditional Chinese medicine believes that gastropathy is related to insomnia. Okay, that's the content about this class. May you have a good sleep every night. See you next time.